thank you very much for the introduction. It's my real pleasure to be here with you today, and I look forward to the next hour when I'm going to be talking about our research, looking at gamification and big data and aging in specifically developing world countries. So those of you who haven't been here for the panel in the morning, so there were just a few slides where I kind of teased from my presentation. So just quickly recap, we have seen a massive growth in the use of mobile technology for the reasons of health, including using apps, wearable devices connected through mobile phones, all the way to people checking information and conditions on their phones. So 31% people are using phones in the US for their healthcare reasons, and obviously this number is constantly growing. Well, it's not just the phones. It was really exciting to see the other panelists in the morning mentioning other devices. You know, mobile phones are just one, obviously the most common and frequently used device, but increasingly citizens are looking at technology ways to assess their well-being, their conditions. They're looking at how they can measure their conditions and their healthcare status at home. They are increasingly use IoT devices like weight, or like this lady downstairs having got loads of wearable devices to assess her conditions. So tracking and mobile phones and personal wearables are also on increase, independently or in conjunction with mobile phones and then disseminated or shared over on the internet. Well, the world big data has got kind of this faff, you know, everyone is talking about it, but no one kind of realizes or defines what it actually means. So the way we've been using the big data for specifically public health, so looking at population health and improving of health of large number of people, is looking at smart data. So how do we make any sense from the big data being generated by Twitter and social media and apps and wearable devices to actually make some actionable information for decision making? Otherwise, it's just a massive data we all store in the cloud and we all analyzing somehow, but unless this has turned into an actionable, useful information, either patient advice or a well-being program and management or early warning prediction, etc., these data are not smart to actually make a difference. So the characteristics of public health, big data, is it's human-generated. Of course, it's the users, patients who are sharing the data. So it's by human, and it needs to be for human. So we have discussed earlier today the issue with Facebook and Cambridge Analytica, where obviously the commercial needs and commercial interests